schools work to distribute guidelines regarding concussion to not only coaches but to student athletes and their families. This also requires doing education with parents and guardians about concussion, as well as getting a signature prior to participation. The law also requires immediate removal from participation if you observe signs and symptoms, and that can be by a coach or an official. And if they are removed from play due to suspecting a concussion, they must be cleared by a licensed healthcare professional to return to play. The list of licensed healthcare professionals is long, so there are many options for students to pursue to get that clearance. And the most important thing we'll talk about moving forward with that clearance is the honesty of the student athlete in reporting their symptoms. So that law has been in effect for some time now. Most schools have some sort of process in play, how they transmit the information to their families, as well as how they get the signatures necessary in order for students to meet the pre-participation guidelines for knowing about concussion. So general definition of concussion today comes from the Zurich consensus statement that was put together in 2012 about concussion. And a concussion general definition is a brain injury that's defined as a complex pathophysiological process affecting the brain induced by some sort of biomechanical force, which simply means that there's lots of stuff going on in their brain. Some of it we don't even know about. There's a cascade of different events with different neurotransmitters that occur inside the brain that affect how a person will respond to everyday things. And those symptoms vary greatly from person to person. Concussion can be a traumatic brain injury as well as what we call a mild traumatic brain injury. And so it's important to understand that. The definition goes further and breaks it down into 4 areas, and I've highlighted in red the things that are really important for you to be aware of. Excuse me. Concussion can be caused by a direct blow, which is what we almost always think about, but what we don't always think about is a fall hard on the bottom can cause a concussion. So somehow an impulsive force gets transmitted up to the head. Usually the symptoms come on rapidly and they have some short-lived impairment of function and that resolves right away, but sometimes, and this is sometimes the thing that catches families by surprise, is that they might be perfectly fine shortly after the incident occurred, but over the minutes and hours after the event occurred, they might develop their symptoms. So just because they didn't present with symptoms at the end of the game on Thursday doesn't mean that they didn't get a concussion. It just that their symptoms didn't manifest themselves right away. They weren't the rapid onset. The other thing, or one of the other things to be aware of, is the neuropathological changes are functional disturbances. So what we see as far as behavior, walking, talking, those sorts of things, rather than an actual structural brain injury, which means they don't, most likely they're not going to have something going on in their brain that requires some sort of neuroimaging. It doesn't mean it can't happen, and based on symptoms deteriorating, we would then want maybe structural imaging to be done, but as a general rule, most people don't need to have neuroimaging done. That's what the research has shown us. And then it's also important to know that loss of consciousness is not important. So many people still believe that you have to lose consciousness to be diagnosed with a concussion, and that is absolutely not true. So the other thing is concussions typically will resolve in a sequential way. So it's important to note that in some cases, those symptoms could be prolonged. So the statistics tell us that 80 to 90% of all people will resolve their symptoms in 7 to 10 days, but there are people who will have what we call prolonged symptoms as well. One of the other things that it's important to be aware of, is that you need to know we can have a subconcussive or subconcussion force. So this is a blow to the head that doesn't really cause a concussion, but over time researchers think that those can accumulate, and there's still research going on with that. So this may mean problems for the future, not necessarily immediate problems that we need to worry about, say, in a particular season, or it may accumulate over the course of a season. So a hit that you wouldn't think could cause a concussion could, in fact, at a later time over the course of the season, caused that to occur. We don't really know what that's going to look like going forward, but what I can show you is a schematic rendering of what that might look like. So this was an article that was in National Geographic magazine in 2011. I know an unusual place to get a graphic from, but this was a helmet that had accelerometers placed inside of it, and it's called the HITS technology. And so this helmet actually had a number of different sensors in it, and they recorded over the course of the season this defensive ends activity. This was actually a college player. And these were the places to his head over the course of the season that he took blows. So you can see that there are yellow, red, and blue lines. Well, those yellow, red, and blue lines indicate the forces that he sustained. So this is the data. So all of the yellow data points are self-concussive forces below 80 Gs. Anything in red was over 80 Gs. In fact, his hardest hit was at 138 Gs, but he sustained concussions at 2 lower numbers. In fact, one that we would consider typically not concussive causing, and the other was well below his hardest hit. So it's important to note that concussion in and of itself doesn't require the big hit, although that's what you usually think about it. And so this is a nice schematic way to show that. So milder hits over the course of time may actually add up to an injury later. So I think it's important to be aware of that. One of the other pieces of research that I've seen is they have actually recorded hits in Pop and Warner football in 9 and 10-year-old kids of 100 Gs or higher. So these kids are bigger, faster, stronger than ever. They're also typically occurring on plays where everybody's going at full steam, be it basketball, be it football, be it soccer. So they're hitting head-on, going 100%, and so that actually magnifies the blow as well. So 4 features that you need to be aware of with a concussion are the mechanisms of injury. So we're going to talk about how you get a concussion a little more in depth, how they might present, what functional disturbances they're going to show up with. These are the things you need to be looking for. And then a graded set of symptoms, which usually follows a typical resolution sequence. So they're fairly predictable. So if they have one or more of these symptoms present, you should suspect a concussion. So they might have somatic, which are physical symptoms, cognitive or emotional symptoms that they may present with. So they may all of a sudden laugh at inappropriate things. That's an emotional symptom that you might see. They'll have physical signs. They won't look well. Their eyes will be not clear. They have the blank look about them is the term that I usually use. They'll have behavior changes that are not typical. They're more irritable than normal. They're more laid back than normal. They don't seem to care about things that they used to care about. And those will present fairly quickly. They might have a slowed reaction time. So you ask them a question that normally they would answer right away, and they don't actually know the answer, or they can't recall it very quickly. And then one that's not immediate that you'll typically see is disturbances to sleep. Research is showing us that sleep is critical to the healing process of the brain, and so letting them get good quality sleep becomes important, and that can actually be something that needs to be medicated if they tend to have the symptoms longer in time, but typically for the vast majority, the 80–90%, they resolve in the 7 to 10 days. They're not going to need any additional help in getting this accomplished. So a mechanism of injury, I've already explained that this can happen in many ways. So this is pretty obvious to most people. So this is the blow to the head, the face, the neck, or anywhere else on the body. So they can be hit with an object, or they can strike an object. So running into the wall, running into the goalpost, running into a stationary person, that can happen as well. They can take a body blow, so the check or the cut block. Those are examples of that. Striking an object also includes the volleyball player that dives for the ball and jostles their head really hard, or goes back to get a ball and lands and hits their head on the floor. The undercut basketball player that hits their head on the floor, or hits their bottom really hard on the floor, or any other sudden deceleration event. So you can think about, the car accident, for example. So the sudden stop. Those are ways people can sustain a brain injury. And there are others as well, but you can see by the graphics that I have provided on this picture that the impact can happen in a certain place, but they might be going the opposite direction, and so their brain actually, using the egg as the analogy, will slosh back and forth inside the head. So the egg itself is the skull, the shell, and the brain inside is the yolk, and the white is the cerebrospinal fluid providing the cushion. And you can actually scramble an egg inside the shell. If you think about your brain that way, it works very similarly. Signs that you'll observe, and this is really, really important for parents and coaches, as well as other student athletes with their friends. So they'll have the vacant stare, I call it this, the blank look about them. They just look not right. They'll have this dullness to their eyes. They appear dazed. They just don't seem themselves. Again, the delayed verbal motor response. They can't focus. You ask them a question, and they're easily sidetracked. They're disoriented. They don't know where they are. They don't know what they're doing. They don't know what the score is. They don't know what the last play was. Those are common things that manifest themselves in students with concussion. They might slur their speech or say things that don't make sense. They might move really clumsily, so if you would do a field sobriety test on them, they would fail. I mean, that's and being able to walk in a straight line, or they stumble in ways that is not normal for them. Depending on the age you're working with, that might, if they're coming into their height or that's some sort of thing, that might be a normal issue for that child, but it might be more magnified than before. Again, the heightened emotions, depression in a way that's not normal for them, so then all of a sudden they were talkative and they're not. The term I always used with roommate to roommate interaction, if they're stranger than normal, whatever normal for them are, whatever normal is for that person, if they're acting way different from normal. So what is normal for that student athlete, what's normal for your child, that becomes important. And then they'll have memory deficit, so they'll forget things, things that happened before the game, things that happened before the practice, post-injury. So when we're asking questions, it's really important that you actually know the answers to those questions. So I teach my students that if you ask a student athlete what they had for breakfast, you better know what the answer is. However, if you know what their parents' names are and you ask them their parents' names and they don't know the answers, that can be something. So always know the answer to the question that you're asking. That becomes really important. The symptoms that they'll tell you, so these will vary from person to person, but they tend to follow a pretty typical sequence. So the headache or pressure in the head is a pretty common one. I'll be the first one to tell you that not every student athlete that has a headache has a concussion. So that is a misnomer, but you have to put all the pieces of the puzzle together. So if you remember a situation in a game or a practice where they fell hard or they got hit hard or they had a helmet-to-helmet contact or head-to-head contact, and now after the fact they're talking about pressure in their head or headache, then we have a different problem. Nausea and vomiting, so they don't feel well. They throw up. Oftentimes the person with a head injury actually will throw up once and feel better, but if it continues to persist, then that's a different problem that we need to be worried about. They'll have balance problems or they'll be dizzy. In fact, one research study says that if dizziness is one of the signs that they early on present in their concussion set of symptoms, that typically those are patients that have protracted recovery periods. So that dizziness piece can actually be a pretty important one. They might complain about vision issues. Everything's fuzzy, blurry. They might see double. They might feel like they're in a fog or a haze. They're sensitive to light and noise. This can be a really big one for some students, where light just is something that they can't tolerate. They feel sluggish, groggy, they're confused, they complain about not feeling right, but they just can't put words to it. And then they have concentration or memory problems. They can't remember things that are very basic and things that they knew well prior to the incident. So those are all symptoms that they'll talk to you about. So this is a pocket tool that's pretty quick and easy to keep on your person, even as a coach. You can get this in a small laminated 5x7 card size and just keep it in your pocket. And this just gives you things that you can ask, clues that you can look for, things to be concerned about and make sure that you are checking, and then if necessary get them onto a medical professional. Some of you will be at places that have a school nurse or an athletic trainer or a physical therapist or a doctor that are on your sidelines for different sporting events and activities that are willing to volunteer their time. They should be very aware of all of these things, but this is, again, something that you can keep with you in case they're not with you at that time, so you know what to look for. So it's a really important tool to have with you because it just helps you identify what you need to know. This is actually a diagnosing tool. that is used in many cases by athletic trainers. So this is a tool that came out of the Zurich conference on concussion. So this is the third version of it. It contains pretty basic information about when you need to get emergency personnel involved right away, and when you answer these questions, it'll give you a pretty good sign of whether or not you should be keeping a student athlete out. My mantra has always been, when in doubt, sit them out. The effects in the long term aren't worth one game, so one game becomes the question. I know there are many who disagree with that, but that is where my stance is on that. With children ages 5 to 12, we're seeing obviously many more children participating at younger ages. This is a tool designed specifically for their age group that's easy for them to understand, puts it into terms that they get, and it also involves the parent as well in this grouping. So there's actually a parent report in number 4 you can see there. So mom and dad need to be involved with a student of this age. So these are just tools that are available. They are all available on the resources piece that I have shared with the group today, and it does come from the sports clinic out of Connecticut. But they are reproducible and available on the web as well through the Zurich consensus statement also. So once you have somebody who's experienced a potential concussion and you've done an evaluation and you've asked them questions, and you've asked them questions right away, and then you've asked them questions every 5 minutes or so, and you're pretty sure that they got something going on we need to be aware of, or that they may have a concussion, you need to get them evaluated by a licensed healthcare professional. So the ones listed in the law that I shared earlier. If there isn't one available, remove them from the field of play. If you have to keep them on the sidelines, you need to sit somebody with them so they can keep an eye on them during the conclusion of your event, and determine if they need an urgent physician referral. And that would occur if they have deterioration of their symptoms. We'll talk about that here shortly. If they need any first aid issues, obviously you're going to do that right away. I know football games in the state of Iowa have emergency medical technicians on the sideline. Utilize those folk. That's what they do. If you have some other worries. And then always no same-day return to play for those student athletes. And if they're fine the next day, you can start them on the return to play progression if you are convinced that they had a concussion. Immediate management. The unconscious patient is always treated as if they have a head and a neck injury, so you're going to treat them appropriately that way. So you would call 911 in that case. If they're an obviously concussed patient, you're going to treat them as if they have a concussion. If you suspect a concussion, you're still going to remove that patient from play as well, and you're going to monitor those symptoms. And again, that comes back to the when in doubt, pull them out. So a really important thing to keep in to consideration. We monitor students, so if you do have the student athlete that's with you and you have no one else to take care of them, you got to keep them on the sidelines with you, you're going to want to monitor them. You're going to want to continue to ask them the questions. We're worried about bleeding on the brain, and again, very few student athletes with concussions ever have this problem, but it's not something that you want to miss. So you're going to monitor them every 5 to 10 minutes for deterioration of their symptoms. So you're going to ask them some of the same questions you've been asking them from the beginning and see if their answers change. The other thing you're going to want to watch for is if they start to have symptoms that they didn't have before. So before, when you did the balance test and you asked them to stand on one foot, they were fine, but 20 minutes later all of a sudden they can't do that now, then we call that deteriorating symptoms. So that's why you don't want to leave these student athletes alone. And if you're not transporting them to the hospital or sending them to the hospital, you need to talk about what to do with home care with mom and dad or parent guardian. And I've also included that in the handouts from today. So a home care guide, it's very generic. It talks to mom and dad or guardian what they need to do with that student at home. And one of the most important things I've picked up on my time is the role of sleep and letting them sleep. So it doesn't mean waking them up anymore unless you're given that very specific instruction by a doctor. But if you're taking them home and you suspect a concussion and they're tired and you get them to bed, check on them every couple hours, but don't wake them up. Make sure they're breathing easy and resting comfortably, and the sleep will actually do them more good than anything else that you can do for them. If you want to provide them with medication initially, we go with acetaminophen products or Tylenol products first. Until you've been given instructions by a medical professional to take something different. So stay away from Advil and Aleve unless you've been given specific instructions to go ahead and take that. Stick with Tylenol at the beginning. So those are two really key things for me to share with you about home care with mom and dad. The other thing we're monitoring at that time, besides consciousness, is look in their eyes. Pretty easy to do. As a non-medical professional, you're not going to do their reflexes or any movement or sensation testing. But if you have a medical professional available, they're going to do those things. You might test their strength. That's something that you can do as a non-medical professional. Just have them squeeze your hand or do a bicep curl. Pretty easy to do. And just make sure they're breathing okay. So those are things that you can do on the sidelines yourself. But a medical professional obviously is going to be able to do way more and monitor those things in a more strict fashion. So the other thing that's really important that I've learned in my time here is that we use neurocognitive testing at Central College, and it isn't the end-all be-all of testing. So we have students who are symptomatic who pass the test and students who have been asymptomatic for 2 weeks and still can't pass the test. So no test is perfect. No single test should answer the question. It should be a constellation of everything that goes together. So nothing can be done in isolation. So we need their cognitive function, what kinds of symptoms are they having, what is their balance like, what's their neurologic status, do they have any other problems that need to that go into this factor. So it's really important that all of these things be taken into consideration when not only diagnosing a concussion, but choosing to return a student athlete back to play. So it isn't easy, and every single concussion you'll encounter is different. They'll respond differently, they'll manifest different signs and symptoms. I've seen everything from color blindness in a young woman who had never been colorblind to a young man who laughed hysterically at turning a pen light on and off at the light because he thought it was the funniest thing he'd ever seen. Absolutely inappropriate. But nevertheless, the symptoms can be all over the place. And the other thing that we see is young women seem to take longer to get better. We still don't know why. The research is ongoing on that. So based on the evidence, imaging contributes little to evaluation. So not every student who you suspect has a concussion needs to have imaging done. Doctors get to make those decisions. I don't get to make that decision as an athletic trainer. If there's a reason the doctor suspects they need some sort of imaging, they'll do the imaging. 80 to 90% of all concussions resolve in 7 to 10 days. First-time concussions in particular. If it's their second, third, or maybe even fourth concussion, that might not be the case. It may take longer for them to resolve. But based on concussion history, first-time concussions tend to resolve in fairly short order. Balance testing is important and reliable. In fact, some of you may be at schools with athletic trainers who have done balance testing on your student athletes. So that's something that can be done fairly inexpensively. And that there is no return to play for anyone at any level, including the professional level. And I think that's a pretty telling thing that even in the NFL right now, they're not returning on the same day if they suspect a concussion. So if it's good enough for a professional athlete getting paid a lot of money, it should be good enough for our youngsters who are doing this just because they enjoy it. So that's something to be aware of as well. So management recommendations that came out of the Zurich consensus with all the medical professionals out there that do research in concussion is the cornerstone of management is rest, physical and cognitive. So their brains need a rest and their bodies need a rest. So initially that's 24 to 48 hours if they're acutely symptomatic. We don't want to go a whole lot more than that because of deconditioning. We want them to be up and moving around as well. Gradual school and social activity should always precede return to play as long as it doesn't increase their symptoms. So they should be able to go back to normal things at school before they head back to the playing field. There's a graduated return to play protocol as well, so that's what RTP stands for. That's return to play. So we have return to learn and return to play. And then there's a role where low-level exercise does come into play, especially if a student has protracted symptoms. They might want to actually do some things to actually move their bodies around as well. And then medication. So any student still taking medication, they shouldn't be cleared to return to play. If their symptoms are artificially reduced through medication, then they're not asymptomatic. So they need to be asymptomatic at rest and exertion without medication, and that's a pretty important piece of the puzzle. So the other thing that I wanted to highlight on this particular slide is that it's super, super important that students don't play video games, watch long periods of television, listen to loud music through their headphones. I'm not saying they can't watch TV or listen to music, but they may need to only listen to what they're watching on television rather than watch it, and they may want to turn the volume down or not use earbuds. So as long as those things don't cause them symptoms, then they're okay to do, but video games do require lots of cognitive function as well as rapid eye movement, and they can actually cause their symptoms to last longer, so give them protracted return to play times. So I'm adamant as a professional when I work with student athletes with concussion that they do not play video games. So that's a pretty important piece of this puzzle. Returning to learn is a collaborative process that requires cooperation from not only students, their parents, but classroom teachers, coaches, and administrators. So this is the whole package together during the school environment. Normal classroom activity must proceed to return to play. They should be doing everything every other student is doing. No adjustments whatsoever made to how much they have to do, how much they have to read. So all of that stuff needs to be normalized before they get back on the field as well. And this requires teams of people working together. So you have your athletic team, your medical team, your school administrator team working together. And this will vary from student to student. Initially, it may be a little bit disruptive to the classroom, but as a student gets better within the first couple of days, you may not need to do anything else. And then for some students, you may need to make no adjustments whatsoever to the classroom.